All right, so we make sure that Scott gets his whole time here. I'm going to introduce him really quick, and then I'm going to spotlight him so that you can see him bright and center within there. But the last speaker we have today is Scott Allen. He is doing Insight to Lived Experience, and he is on the, the board of directors of the Autism Society of South Central Wisconsin, and a therapist at LifeStance Health. So Scott, I'm going to go ahead and spotlight you and give you the mic here and let you go.
All right, thank you. Let me make sure I've got everything adjusted on my end. There we go. And let me also share screen. So let me get that figured out if that is the thing. Okay, or at least I'll do that in just a moment. So yes, thank you. Glad to be here. Really interested in the sheer range of things that we could discuss here today. Yeah, so in terms of what I am bringing into this conversation, as was just mentioned, I am both somebody on the autism spectrum myself, and I am a professional counselor working primarily with autistic adults as my clients, well, some non-autistic clients. In addition to my roles through the Autism Society, where I am a facilitator for our adult community groups, as well as a board member. And in addition to my work at LifeStance, I'm also a co-facilitator of a group through UW-Madison called As We Are, which is a student empowerment group for students on the autism spectrum as well. So I'm bringing in a range of one-on-one and group work clinical experience, as well as community group experience. So I'm trying to be, plugged into a range of things through my professional and volunteer life, just so you have a general sense of where I'm getting these impressions, where I've been, seeing what is going on within what we call the autism community, so on and so forth, as I launch into what I want to talk about today. So overall, and I'm just going to really dive right into sharing some impressions of some of the major things that, again, from my perspective as a counselor in particular, that I am seeing as being important to consider in terms of additional services, ways of thinking, frameworks, and so forth, that are, to my best understanding, right now not necessarily adequately met or adequately understood for individuals on the autism spectrum who are seeking mental health support. And so I will launch my presentation here. And just a moment, there we go. So as I'm sure all of you here know, but as also always bears repeating, people on the autism spectrum are highly diverse. What we call autism represents an enormous range of different manifestations of many different kinds of traits and combinations of traits, all of which have their own unique synergy, as well as everything else about a person and their background that can be distinctive in the ways that in which autism intersects with other elements of their identity, their life experience, whatever else they might be bringing into a mental health space. And so the thing that I want to start with and to emphasize, because I do see this not always being adequately supported, is that autistic people are individuals. They are people who find themselves in unique circumstances. Certainly there are general trends and certain commonalities or things that tend to be commonalities within the autistic population. But overall, the ability to customize what is being done in a mental health setting to the needs and circumstances of the individual and everything that implies a range of ways of thinking, having more than one set of options that might be applicable to a given individual, and above all, being able and willing to check in with the individual about what their needs and experiences may be. I have I've been working in my current capacity for a few years now, since 2019, in addition to having a lot of other like group experience kinds of stuff before that. But in terms of being a working counselor, I've been doing it about that long. And I have had a number of autistic clients come to me with what I call horror stories about having worked with previous therapists. And I never want to step on anybody's toes or be too, condemning in listening to and considering those sorts of experiences. I don't want to necessarily attack previous therapists, but I do routinely hear things like the individual needs of the client were dismissed or even mocked in some cases. And the approach used was simply a standardized cookie cutter, one size fits all sort of thing, that there wasn't any willingness, or not much willingness at least, or very gradual, reluctant willingness to adjust to what the client was actually asking for, which in the vast majority of cases was an understanding of social situations that then at least some providers seemed unwilling or unable to provide. I'll get more into that later. I also do have some clients who have described positive therapy experiences as well. So I do want to mention that just to make sure that I'm being fair and even-handed in that regard. But anyway, overall, being able to check in with the individual to the extent possible. Everything that I'm going to say today is to the extent possible. Autism is such a wide-ranging condition that not everything that we say about it is going to be applicable to every person. So I know that not every approach might be fully appropriate given any number of different kinds of needs in terms of whether it's emotional processing, cognitive impairment, or whatever it might be. Not everything applies to everybody. But that's exactly my point, is that this customization is crucial, that being able to consider the context of the individual, to hear from the individual as much as possible, and if not possible, then, to figure out what you might do about that. But anyway, so everything that I just said is supported by an understanding of bias and critical thinking. Now, when I say bias, I don't mean it in the politicized sense of bias about specific identities, not necessarily, prejudice or bigotry. Those are forms of bias, of course, but I'm talking about bias in the general sense. Any kind of preference or assumption or inclination that a person may have about anything. Now, what I'm getting at here is that all human beings have any number of biases. We all have motivations. We all are sort of drawn to some things instead of other things. But the biases that autistic people have tend to be a different set of biases from those of the people around them. They are neurologically distinctive. They are processing the world differently on a sensory level, on a social level, on multiple other layers. And the biases that autistic people tend to experience are usually recognized by society as things that need to be rejected, excluded, punished, or otherwise devalued. And at the same time, the biases of the normative population, the neurotypical population, are either ignored or are directly accommodated. They're considered par for the course. So we have two sets of bias, and I don't think either one is better or worse, but they are different. And when one set of biases is recognized as a problem or the problem, and another set of biases is taken as just normal background noise that is built into how society functions, that results in a lot of the unfairness or exacerbation of existing problems that we see within the autistic experience. And to be told that your way of thinking, doing, performing, etc., is incorrect, deficient, in need of support, whereas other people's way of thinking, which might not, again, be any more rational, but that doesn't need support. That's normal. That's okay. That is an imbalance. I have been saying for years, I think that, well, first of all, let me say, I always tell people, because this is true, my favorite page on Wikipedia is the list of human cognitive biases or cognitive errors or whatever the name of the page may be. And it lists all the ways in which human thinking in general can go wrong. And it's this giant list of something like 200 different items, different ways in which people's perceptions can be flawed. And I think that all children, all people need to be taught starting at a young age that they have ways in their thinking that can go wrong, rather than one group of people sort of not being told that, and one group of people being told that their way of thinking needs to be constantly evaluated for whether it does or doesn't fit normative thinking. All of which is to say, and to summarize, providers, I think, need to have explicit critical thinking training regarding autism and related issues, to be able to have training on how do logical fallacies work, what are other kinds of mistakes that can be made in order to support the customization that I was talking about on that last slide, because it's so important for providers to be able to not just have this sort of set of preconceptions about what they're trying to do, but to be able to adaptively adjust. And that requires critical thinking. How might this work for this other person? How can I do some hypothesis testing, some perspective taking, some, figuring out whether or not this might apply, and to be able to, where possible, help the client engage in critique of their thinking, of the society around them, and so on and so forth. I could go on, but I'll move on instead. All of this also connects to the idea of flexible thinking. When I work with clients, especially with social anxiety, which is very common in my client population, one of the major things that I really try to drive home is that rather than thinking categorically about is it or isn't it, is it good, is it bad, is it right, is it wrong, these kinds of dualities, to think instead of type and degree. Under what circumstances is something good or bad? To what extent is something good or bad? Is this thing, maybe partially good, partially bad, or right or wrong, or whatever other, binary you care to name, because this kind of flexible thinking is much more useful to the individual. So even things like when we ask, is autism a disability? That's a categorical question as opposed to a contextual question. So like for me personally, I have never thought of myself as disabled or as having a disability. And that's because I don't experience it that way. Whether that's a legal disability is a separate question, but in terms of whether this is disabling for me within my experience, I would have to say no. But that's just my experience. That's not necessarily reflective of many other people on the autism spectrum. And so to be able to say under what circumstances is autism a disability, and then to what extent, what degree is it a disability in those circumstances, those are more useful questions because they get into details. They are considering what is going on within a system, a set of factors that are interacting with each other, influencing each other. Just the categorical question of is it or isn't it doesn't help that. It's not dynamic. It's a static yes, it is, or no, it isn't. And it does not help the individual nor the practitioner be able to approach these questions in a context-dependent manner and to be able to adjust their thinking more effectively. So critical thinking and flexible thinking are closely related and they support each other. So what do I use? I think I can illustrate some of what I feel is missing within a significant range of mental health practice regarding autism by illustrating some of the things that I focus on and why. So I'm going to begin here, which is rational emotive behavior therapy. Now, this is my version or my approach to CBT components. You'll possibly hear, and I've certainly been, getting bits and pieces of autistic people, even some autistic clinicians, criticizing cognitive behavioral therapy. I think that goes a step too far. I do think that just providing cognitive behavioral therapy without the rest of the context and without adapting it to autistic needs is not likely to be effective. But I do think that cognitive behavioral approaches are relevant and important for basically everybody. Rational emotive behavior therapy is my particular focus because it is a model that relies on identifying ways in which a person's thinking can be distorted, why that is, and what is the relationship between how they think and what they feel. Or actually, as I say, how you feel about what you think and what you think about how you feel. These are feedback loops that influence each other, and being able to lay that out logically and illustrate that there are specific principles and dynamics that can be understood can help a person navigate these kinds of questions directly and consciously, which is important and dovetails with the fact that autistic people need a lot of stuff to be made explicit rather than just trusting that they have this underlying intuition about it. I could go into more detail, but I want to make sure I'm moving on in a timely manner. So in addition to the intersection of logic and emotion, and I will say emotions have their own form of logic. They're not the opposite of logic, but all of that is under the rational emotive behavior therapy component. I also use a narrative therapy component, which is built around how are you going to understand yourself as an autistic person in a society that is not built for you and doesn't necessarily understand you. So narrative therapy is about turning the pathologized, devalued version of an autistic identity into a positive or at least neutral one, at least something constructive for the individual. And being able to recognize that one is okay as a human being while being autistic. Autism is not something that has to be purged from their identity. It does not have to be something that is overcome. It does entail various challenges, various concerns and issues that need to be addressed, but you can be a psychologically healthy and well-adjusted person on the autism spectrum. That's at least conceivable. And narrative therapy helps to recognize the ways in which the narratives of the society around oneself don't necessarily match or promote one's own needs or self-understanding. Many narratives in society at large carry unreasonable assumptions or baggage about what it is to be a good or legitimate human being. And to be able to question those and if some of those societal narratives are effective for you, then you can keep those and you can have them as part of your own framework. But there are many elements that will not work for you. So you need to be able to figure out, okay, what is your personal narrative? Not how are you going to try to live up to some other standard that isn't effective for you, or that you're going to exhaust yourself and run yourself ragged trying to live up to if you've internalized that. How can you internalize a sense of being okay with yourself, being confident about yourself, independent of, or at least intersecting with the society around you rather than being dominated by it? Again, I could go on. There's so much more to say on all of these different subjects, but I just want to give a flavor of the kinds of things that I'm seeing and doing. Solution-focused therapy, which normally this is solution-focused brief therapy, but in this case, the kind of work that I do is not necessarily brief. Actually, the need for long-term care, I will say, is not adequately met really either. Most autistic people are going through such complicated circumstances that figuring themselves out is going to take a long time. It's not going to be something where you target a single issue and then you're done and you move on. You're going to need a lot of unpacking to figure out what is going on for you and what it means to you. But anyway, so the solution-focused therapy component to me is useful for wherever a client might need something more directive to say, okay, what in fact are you going to do about this situation? What are you going to do about learning a social skill? What are you going to do about interacting with another person? What are you going to do about executive functioning needs? And in fact, I mean, my understanding is that executive functioning research is still pretty much in its infancy. And so we don't have a lot of good supports for executive function. I just want to plug that because that is one of the challenges that I find most difficult to support. I have my own executive functioning life experiences. I use that as a basis for helping people to try to work on establishing different habits and so forth, but it's pretty basic. And I really feel the dearth, the lack of information about other ways to think about executive functioning. The generic organizational skills kind of stuff is not effective. For the vast majority of autistic people. It can be a little effective here and there, but anyway, to be able to very pragmatically drill down into what in fact are you going to do is what this solution-focused component is intended to address. One of the biggest gaps that I see is the lack of existential questions in supporting the mental health of autistic people. During my initial training years, which were 2012 to 2016, when I was at UW Whitewater, I began to notice in a variety of contexts that when there were, for example, students on the autism spectrum who were asking questions about, who am I? Do I have a legitimate place in society? Am I going to be able to have meaningful relationships with other people? These kinds of questions. I knew some folks who were pretty good about addressing those kinds of things, but I also saw many examples in which those questions were simply deflected from, and what was shifted back to, and this was not just at Whitewater, this was at various other places over the past number of years, in which the focus was on, well, let's give you skills. Let's give you life skills, let's give you social skills. And like, okay, those are important. I'm not here to deny that. I think that's essential in itself. But that by itself, here's a bunch of skills, but you don't know whether you have worth in society. How are you going to tell what you're going to use those skills for? What are you going to apply them to? If you fundamentally doubt your legitimacy as a human being, then being told, well, here's a bunch of skills, go deal with it, that's not complete. So being able to address those kinds of questions from a variety of angles, I think, is really important. And right now, existential therapy is not popular within our insurance-driven mental health support systems, because it's not as measurable. It's not as, compared to something like CBT that has a bigger research base for, how it works and all that kind of stuff. It's not as medicalized. It's more subjective. It is more personal. And that is exactly what is then missing in these kinds of supports. How are you going to understand yourself as a person with a significant set of differences? And what are you going to do with your time on Earth? How are you going to navigate being a person in this society? What is valuable to you? How are you going to make those decisions about what is important and what you want to experience in life? And just saying, here's a set of skills, again, those are useful, but they're out of context. They don't have a framework within which to justify their use. So I think that being able to consider these existential questions is absolutely essential for a large fraction of autistic individuals. So the single biggest one that I want to drive home is psychosocial education. I know I've listed it last, but think of that as best for last. This is the one that the majority of autistic clients, in my experience, come to me asking about and want to go deep into details on, really deep. So being able to say things like, here are the unspoken social rules, and here's why they exist. Here are the functions of small talk. You might hate small talk, and people might not normally think of it as having functions because they're just doing it intuitively, but it does have functions, even if they're not understood, even if they're not, recognized and made explicit, or any number of other social dynamics. What is it about what is going on socially that can be made understandable? What can be explained? I always say during presentations like this that I have 9 rules for effective communication with autistic people, which are direct, 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 explicit, 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 clear, clear, clear. And this is all about that. This is about going in depth on the mechanics of interpersonal interactions. The difficulty in general is that most neurotypical practitioners, and this is to varying degrees, this isn't, I don't want to be too broad brushstroke about this, but neurotypical people tend to take this stuff for granted because they're doing it intuitively. They don't have to think about it in detail. They don't have to be aware of the specific mechanics and dynamics that are going on. They just kind of do it. So being able to become aware of what are, in fact, the underlying reasons that we engage in a particular kind of social behavior to then make that available to the understanding of an autistic person. This is where it all dovetails back with the critical thinking, because autistic people either do not have social intuition, or with social intuition they have tends to be unreliable. Not exclusively so. I've known some autistic people who have some bits and pieces of reliable social intuition here and there. But in general, it's such a different format from how other people think that it's not reliable for being able to be a guide to social interaction. And so if an autistic person is going to understand how to navigate social situations, normally they have to do that consciously. It is their conscious awareness that helps them get through it. And if you're going to consciously be reasoning through how and why other people interact, then having strong critical thinking skills and a strong base of knowledge about the function of, or just the existence of different social phenomena is going to be really important for being able to make that effective. And again, I could go into so much more detail about this. This is the single biggest thing that I talk about whenever I'm engaging with autistic clients. Like, we usually are talking about this kind of thing first and foremost. So I want to illustrate some common hangups that I have also observed within sometimes fellow therapists. And again, I don't mean this as an attack, but just to observe that there are these gaps that I would like to constructively help to fill in. So, for example, this is the one that I want to shout from the rooftops. Emotions as cause versus emotions as effects. Many of the clients who have come to me expressing dissatisfaction with previous therapists have, in their own ways, and it took me a while to kind of piece together that this was all the same theme, have all emphasized that the people that they were working with as therapists wanted to work primarily on emotions and not primarily on social understanding, despite the fact that the clients had often gone explicitly for social understanding in their seeking of support. And what I eventually came to realize is that, at least within counseling, most counselors are trained first and foremost to view social difficulties as the result of emotional difficulties, that you've got some kind of emotional blockage or other emotional issue that then leads to social problems. Therefore, if you can reduce or resolve the emotional problem, then the social effects will be improved. Whereas with autistic people, I mean, that can happen. That is something that occurs to autistic people. There are, emotional issues that autistic people can have that need to be addressed in that same manner. But more often, or at least just as often, is that a social processing difference results in social alienation, which results in negative emotions. Other people find me different. I don't understand other people well enough. That's really frustrating and confusing, and I have a lot of self-doubt, and how am I going to understand this? And therefore, I feel like I am either internalizing it and attacking myself, or externalizing it and lashing out at others, or whatever. And the causality is flipped around compared to how counseling is normally conducted. And if a therapist doesn't recognize or understand this about autistic people and the autistic experience, then trying to go after the emotions when the emotions are the effect, not the cause, is going to feel further alienating or confusing or dissatisfying for the client, because their lived experience is now being viewed backwards. We're seeing your feelings of alienation as the problem rather than the results of the problem that you're experiencing. And of course, that's going to be frustrating for the client at best. So this one is really important. And again, this gets complicated because you can have both of these things at the same time in an autistic person. They could be having a social to emotional issue and an emotional to social issue simultaneously. They could feed into each other or be entangled with each other. And that takes a lot of further processing, which I should mention. This is more of an aside, but one of the things that I frequently tell clients, because they'll come to me and say, sorry that I'm kind of talking about things all over the place. And I always say, counseling does not have to be linear. You do not have to have a predefined narrative. You can, I know puzzle piece metaphors are not popular within the autism community, but I think in this case, it's appropriate that in counseling, you're going to dump all the puzzle pieces out on the table. And you and I, as counselor and client, are going to look at them and consider what they mean and how they might go together. Because if you are confused and full of self-doubt and you're coming to me for understanding about what might be going on in your mental health, and I, as a therapist, ask you, so what is your narrative? Lay it all out for me. Like, what if you're there for that? What if you're there for my support, help you get it laid out more effectively, because you don't have it articulated yet. So for somebody just to ask you to explain all of this kind of stuff when that's what you're trying to understand yourself is not going to be effective. But one way or another, these sort of feedback loops are not necessarily linear or easily understood. They can be, snared on each other, and to be able to sit down with somebody and look at multiple different pieces of the problem and come back to them as needed where we see possible connections has been, to me, a slower but much more effective approach to working with autistic individuals, and frankly with neurotypical individuals too. I do this with all of my clients, this nonlinear. We don't have to have a nice neat narrative about this kind of stuff. We can kind of craft narratives as we go and revise them as needed. Anyway, I'm going to move on. So related closely to the psychosocial education component is I often see that there is not enough offering of templates for the understanding of the client. I know within much of counseling and other helping professions, there's this assumption of, well, the client has enough resources to be able to resolve their problem if they can get unblocked, if they can understand a few additional things, or sort of, not have these other emotional issues standing in their way, getting in their own way. And that's not necessarily true for autistic people, because if one of the big problems that they're facing is, emotional pain over not being able to process social situations effectively, whatever that may mean in context, then they need a template to be able to do that. You need to be able to explain to them, hey, I think this is probably what's happening, or what might be happening. What do you think? Does this seem to make sense to you? Rather than saying, well, just what do you think? How are they going to know what they think? Our society doesn't provide them with an education about social standards and social rules, at least not the kind of education that would be, helping them to be fully effective. And so this also kind of dovetails with the idea that, and this is a whole broader set of issues, but you can't really you can't train an autistic person to be a good neurotypical person and expect that to work out for their mental health. That just doesn't make sense. You have to help an autistic person learn how to be a good autistic person, to be the most of their own kind of individual, rather than saying you're going to meet all these other standards that really don't apply to you and don't fit your neurology. But overall, being able to go into a more psychoeducational mode of, here are some templates for what you might consider doing in a social circumstance, rather than saying, like as counselors usually do, well, I'm not here to give you advice. And that's fair. I mean, I shouldn't be giving advice per se, because I don't know your full circumstances and whatever, but I have to kind of lean into giving something that approximates advice about a lot of social situations, because otherwise you're not going to see how this might work. You're not going to understand what are the issues, what are the possible solutions, how might a successful social interaction look, and why, like what might be going on to undergird your understanding of why this particular set of strategies might be relevant, or why to look for this set of social signals rather than some other set. And that again, can look a lot like advice giving, but that's exactly what many or most autistic people need, so that they can have at least a basic template to begin generalizing from. And always working at generalizing. You're not just going to say, here's my advice on how to get through this one situation. You're going to say, here are the underlying principles, and here's how these apply, not just here, but across a variety of other social contexts as well. The ability to adapt and adjust across social contexts, of course, being one of the major factors that is challenging or a concern for autistic people. Another big one, and so much more than I'm going to have time to go into here, is what I'm going to call limited cultural understanding. And I mean this in the most fundamental, like literal sense. I don't think Americans in general, and I don't claim to be an expert on this, but I do think this is important. I don't think Americans in general have a good grasp of what culture is and what that means at a deep level. What does it mean to have different cultural values? Why do people value things differently? Why do different kinds of life experiences contribute to different systems of value? How do people transmit beliefs, values, normative behaviors, etc., within a cultural environment? These kinds of things are, to me, essential to understanding autism, because autism is subjectively valued or devalued in various ways by the society around it. We're not just looking at objective differences in ability, we're looking at subjective cultural differences in which abilities are valued and why. So to be able to say, for example, that if an autistic person's experiences can be related to a more normative experience, then they can be more understandable to other people. Doesn't mean that their experience is going to be exactly the same, but it can be put in terms that maybe can be communicated more effectively with other people. So that, you know, these differences in autism can also be seen as degrees of similarity rather than just degrees of difference. Everybody on the autism spectrum, everything about the autism spectrum is a human experience. And nothing that autistic people experience is fundamentally different from other humans. It's different in degree, different in intensity, different in combination, but there's nothing that autistic people experience that is something that other people just don't experience. It can have all sorts of variations and be different in context, but there's some kind of parallel to everything that can be understood. And also to illustrate more directly the cultural element of this, I have heard multiple people on and off the spectrum talk about how, in some cases where they knew autistic people, if they were themselves not autistic, that when autistic people would travel in other countries, they would do better socially than they do here in the US. And that's a very curious thing. And the general explanation that people offer for this is that in other countries, the autistic person is considered a foreigner. And people living in that country say, oh, well, those strange behaviors are because they're a foreigner. They're just a weird American. Americans have strange cultural practices, and this must be some set of American stuff that we just don't understand. And so we're going to give them more leeway. We're going to give them more grace because we know that we don't understand their cultural habits or tendencies. And that's great. That's an effective way to interact with a person from another culture, to say, I don't get all of what you're experiencing, so I'm going to be more patient with you. And I would hope that we would all do that for each other across cultures. But what is interesting to me about this is that then the key difference is the giving more leeway. If people from another culture can say, well, they're just a weird American, and so we're going to be more patient with them, and that then helps them socially, then why can't Americans be more patient with autistic people? Why is that something that has to be a pressure or a burden, or you have to be a particular way, or we're going to reject you, or whatever, which underscores how much of the autistic experience and autistic challenges are in fact cultural. They are either caused by or exacerbated by cultural beliefs and values of the people around them, in a way that when that pressure is removed, the individual tends to do a lot better socially and emotionally. And this kind of thing and the factors underlying it are not well understood or well explicated even within, frankly, this is broad brush strokes. I'm extrapolating from my own experience. This might not be universally true, but even within multicultural training programs for counselors, I don't think a deep dive on what culture is in a more anthropological sense is really provided. It's more of a surface level. How do you work with some specific cultures? How do you think about some common cultural issues? And all of that is good. But really getting into, why do human beings value different things differently? That kind of question has been tremendously important and a backbone to my narrative work, especially with autistic clients. And I don't see a lot of this in evidence in other parts of the mental health system as it exists currently. Beginning to wrap up, I think this is my last or second to last slide. I want to keep this one briefer if I can, but the idea of best practice. So I think that there is, of course, such a thing as best practice. We need to have some sort of standards around what do we broadly consider to be most reasonable, most effective, most ethical in working with any population, autistic people included, of course. But I've also sometimes gotten an impression, and maybe it's a vague impression, but an impression that sometimes best practice is brought up as a reason not to customize to the needs of the individual. To say, oh, well, that's not best practice in this categorical way, rather than checking in with the individual. Because the fact is that every individual person has a unique individual best practice for them, their circumstances, their abilities, their concerns, their goals. There's only going to be, it's going to be a range. It's not going to be one thing, but there's going to be one range for each person as to what is going to be most effective for them. And that's going to be their best practice. So obviously, we have to have some bigger generalities. We have to have some universals. We can't, say everything is customized, so we're just not going to have any, larger standards. We need something to guide how we get to the customized supports for the individuals. But the metaphor that I use to illustrate this is if you went to a pizza restaurant and they said, well, we only serve pepperoni pizza. We've determined through surveys and studies that pepperoni is the pizza topping that is most likely to satisfy our customers. So we have decided that it is best to only serve pepperoni because that is the statistically most effective topping. What if that doesn't work for you? What if you're vegetarian? What if you don't like pepperoni? What if it makes you sick? What if you just want some variety in what you're having? Being told, well, pepperoni is the most popular and the most likely to satisfy people, therefore that's the only one we're going to offer, leaves you with restricted options if you're not one of the people for whom that applies. And I think something broadly similar might be said of best practice within mental health, that there is such a thing as best practice. We absolutely need to have what we would call a best practice, and we need to make sure that it's not becoming a substitute for providing more specific or customized things to the individual, because what we consider best practice, they if you're looking at it on like a bell curve, they might be closer or farther from what we consider current best practice in terms of what they need in order to be able to thrive. So I am going to end my show. And I didn't have a whole lot of time to practice, if I'm being honest. I've been having my own executive functioning issues, but I'm glad that the timing worked out in terms of I was aiming for about 40 to 45 minutes. But I am curious about questions and yeah, and actually I'm a little, I need a reminder if we're doing questions only through the chat or if we're doing that through the spoken component or how we're going to approach that.
We are going to approach it as only through the chat, Scott, because we have over 100 people still connected.
Yep.
So we will be looking at the chat. But so far, Scott, my fault on our end. If anybody just had their eardrums blown out, that was our fault. People are like waiting to get the recording, because I very much agree with them. This is information that I have not found anywhere else. This is needed information. This is the voice, the point of view that is missing from the mental health discussion. I have learned immensely, things that I hadn't considered before. So thank you very much. So we will, so if you do have a question for Scott, please put it into the chat and we will relay it to him. So I guess one of the questions that I have, Scott, is how do you balance this is hard for all counselors, balancing inserting your personal experience and your personal point of view or life into counseling with the person, because there's supposed to be sort of that differentiation. But I can also see where your individual background could be such a strength in providing support for the clients you see. How does that work for you?
And yes, very much a relevant question that crops up continually in my work. And really how you just framed it is basically how I see it as well, that I have potential strengths in being able to bring in examples from my own personal experience to be able to illustrate things on behalf of clients. And at the same time, it's important to make sure that I'm not imposing or being presumptuous about how my experience may or may not apply. And my approach basically is to be direct with my clients about that for the most part, we're talking about their issues. I'm asking them various clarifying questions or observing things that may or may not be, trends, and then checking in with them. Like, does that make sense to you? Does that seem to resonate with your experience? Those kinds of things. And more so than other counselors, I think in general, or at least this is my impression, I do bring in selective self-disclosure. And for exactly these reasons, to be able to say, in my experience, I've gone through this, or I've seen that. And it's always in the context of not just saying, here's how I experienced it, but how does this compare or contrast with your experience? Does this help you understand something about yours? Does this bring up something for you that you maybe have also observed or felt, or maybe you hadn't thought about it that way before? So I'm bringing in my experience always as a tool to bring up further conversation or further exploration with the client. It's not saying I experience it this way and that's that. It's saying this happens to be my experience or my understanding of my experience, and how might that impact or inform your understanding? How might this make some additional concepts or frameworks available to you? And generally speaking, when I do that kind of disclosure, clients find that to be relatable or interesting. Once in a while, not. Once in a while, it's more like, no, I have a different kind of experience. But even that, even when there's a contrast, it brings out greater clarity, because now we can talk more specifically about what exactly is different. So one way or another, it's providing more information to me, and then I'm providing feedback to the client. And so I'm not imposing a set of values or experiences on the client, but I am being honest about mine so that they can further reflect on theirs. And always with, being selective about, does my experience really seem like it is potentially a useful thing to discuss in this particular client context? I'm not just going to do that arbitrarily. I'm going to do it as a way to get at something specific that the client is experiencing. I also want to mention, just as this is an aside and stepping back to something that Tim, you kind of had mentioned about not having heard this information in other places. And I just want to say, I don't know if I'm going to call this a dream or just a thought of mine, but I would really like to be able to operationalize my understanding of these kinds of things, to be able to make them more widely available for other people. What I don't know is how much of what I do or say necessarily is of interest. What do other people know or not know? What might they like to learn about what I'm doing? And so sometimes sitting down to write up like, this is everything that I do, feels kind of scattered, because I'm not sure how to target it to the audience that might best be able to use it. So I would really, in principle, love to be able to, I'm just going to phrase it this way, to be able to sit down with a range of professionals and to just talk about autism issues and get feedback from others about what seems relevant, what seems interesting, and then to be able to use that as the basis for a document or a course or something like that, so that I can be able to more specifically target and organize and like respond to people's questions about, because that's what I often find is a difficulty, is that there's so many other possible details that people might have questions about. And then if I just sort of give a generic description of what I do, then those questions don't get answered. And there could be a lot of content that is missed that way. So yeah, if anybody, I don't know, I guess I'm just sharing that because if any of you as professionals might be interested in doing something like that, as sort of like a little project or counsel or something, I would be all for that. So
I will be, well, I mean, I have limited organizational skills, as many people will tell you, Scott, but I would love to help join you on that, to sort of convene that group, because I think it's vital. We need to help each other stay healthy. mentally as well as physically. And I think we're missing a lot. We have a number of questions that we'll try to get through a few of them here. If not, I'll connect with you to see if we can answer some offline and sort of post it as sort of a Q&A.
Sure.
But you had talked about templates. Can you give an example of a type of template that you feel works well in helping someone understand the situation?
I tend to kind of be creating them on the fly when I'm working with a client because I'm customizing it to whatever circumstance they've brought to me. I know a pretty recent example without going into detail. I had a client who was feeling nervous and uncertain about how to navigate it was a workplace dinner. It was like a dinner event with coworkers. And that was the sort of case where I think under a conventional counseling model, a counselor would say, well, I'm not here to give you advice about that. You have to work on yourself and your own emotional understanding for what is making you anxious about this. And, there is a component of that. But because this was an autistic client, I went through and described, okay, here is my understanding of how those kinds of functions tend to go, and what sorts of unspoken social rules are going on, like the fact that everybody's being friendly, but you're all co-workers, so you're all kind of concerned at least a little bit about your reputation, and if you don't know them very well, then they might be feeling kind of the same way, and they're all sort of networking and looking for their own leverage while also trying to be kind of genuine with each other to some extent. And we went through these kinds of details that I think hold true but aren't readily apparent to somebody who doesn't track this kind of social stuff directly or intuitively, or whatever the case may be. And so being able to provide in this case a template for, here are some of the factors and behaviors, considerations, possible things you might run into as obstacles, so that you have a working framework for what this is going to entail, that you can more readily recognize and respond to your circumstances rather than simply anxiously withdrawing as your only option. That's the kind of thing that I mean as providing a template for getting through a social situation. And we talked also about how all of these things are things that aren't just in this one circumstance. I mean, this combination of factors is this one circumstance, but the general idea of many of those things still applies across other situations when we're interacting with other people for small talk or in work settings or what have you. So being able to broaden and generalize from the one example is also significant.
And that's, Scott, we have a number of educators joining us this morning. Do you have ways that you think what you have talked about could be incorporated into the educational system and into classrooms?
In principle, yes. I don't know that I'd be able to give a really concrete answer right now, since I don't know enough about the educational system, but I will say this. I do see a large fraction, if not a majority, of the issues faced by autistic, both children and adults, as being matters of education. So rather than providing quote unquote treatment, I don't really see myself as providing treatment in anything but the most, semantic sense. But I do see myself as providing psychosocial education, that it is an educational gap. Autistic people, in order to be effective and feel more functional and confident in themselves in social environments, need to be taught explicit social rules, rationales, strategies, and so forth. And that's teaching. That's not mental health. That has to do with their mental health. It improves their mental health by giving them tools to feel like they can live their own lives effectively. But it's not just work on emotional blockages or other sorts of things that are traditionally considered to be mental health topics. So being able to think of this as educational, and also, like I was saying earlier, non-autistic kids also need education about the ways in which they can have cognitive errors and biases and so forth, because that's also a gap in our education. But to think of this stuff as a problem of missing information that needs to be conveyed, rather than a problem of just inherent deficits, I think would be a tremendous improvement over much of what goes on currently and how we conceptualize these things. I think I know we're sort of drawing close to.
We are. So I'm just going to do one more question, and then
Sure.
I will connect with you for the approximately 700 other ones that have been. Okay, I might have exaggerated, but there are many really good questions that we might have to wait to convene a think tank to figure it out. But I really I did want to ask the one from Autism Society of Southeast Wisconsin, which of course I can't find now, because that's just the way my life goes, Scott, sometimes. Well, it had to do with trauma, because I know that that's one of the touch words. And do you have any ideas about how to help someone who has who's autistic and has experienced trauma, but they're not showing the normal signs of distress? How might we be able to identify trauma?
Yeah. So I think that, first of all, obviously there's different kinds and degrees of trauma as well. And so that's obviously going to be context dependent, but I think even for lightly or non-traumatized autistic individuals, there is a tendency to hide vulnerability because that's what American society teaches them to do. It says that if you are vulnerable, then you must be weak. And if you are weak, something is wrong with you. And therefore, if other people know this, then they're going to reject you for it because that's some kind of character flaw on your part. I could go into more about how moralizing everything is sort of one of the flaws in the American cultural character. But I think being able to check in with a person about what are they feeling, what are they thinking, to the extent possible, about various sorts of things, and checking with them, but how are they reasoning through something? How are they understanding whether, are they at fault? Are other people at fault? Are they possibly hiding something that is bothering them? Do they feel safe sharing that in that particular mental health space? Those kinds of things. Because many autistic people simply suck it up and deal with it in ways that they don't even recognize that it's unhealthy for them. They just think, well, everyone else does this, so this is normal, and they're suppressing parts of themselves because as autistic people, they're doing it differently than other people. And then they're going through this intensive masking or self-suppression or trying to keep up with things in a way that is exhausting them. And because they are processing this as just a normal thing that people do, they don't recognize that they're living out something that is in fact not good for them. And to be able to make those sorts of things explicit and say, is your experience of this like this? If so, that might actually not be healthy because maybe this norm, this standard for other people doesn't really work for you. So to be able to check in, like, are they blaming themselves? Are they taking on too much from other people or from societal narratives about how they live or how they're operating and conceptualizing these sorts of things? I could try to go through more specific examples, but we're not going to have time right now. But these kinds of things, just to recognize that a lot of that might be withheld, and often it might be withheld not out of like trying to actively hide, but just because they don't realize it's relevant. So being able to get into details of that kind with the individual and check what their experience might be. I do want to.
I will get you the real. I will get you the real question too after we're done. So please go ahead and
Sure.
close out, and then I'll close the big thing out.
Yes. I want to do two things, and this serves two purposes. I want to extend my personal invitation to all of you to the Integral Adult Autism Conference, which is a conference that I am the co-founder and team leader for. It is Wisconsin's first adult autism oriented conference. And the reason I want to emphasize this here is because this is actually another thing that I think is missing within our mental health systems. The whole premise of Integral, we've been trying to get it to work more along these lines. We're maybe getting there, but it hasn't looked ideal just yet. But what we really want is for there to be a space, which we've conceptualized as a conference, but we're open to other ideas, a space where autistic adults, non-autistic parents, and non-autistic professionals of various kinds related to autism can be in the same space, interacting with each other on equal terms to figure out collaboratively what is going on in autistic lives in a boots on the ground, real world sense, that then can be used to better understand the needs of autistic adults and how systems might need to change or otherwise, support autistic people. And so far, we've been doing this since 2019 each year, and we've had quite good attendance from autistic adults, middling to fair attendance from non-autistic parents, and generally very few non-autistic professionals. So our model of trying to bring these groups together as a single overarching community have not yet been effective in my estimation compared to our overall mission. Like, we've had good conversations and been able to provide all kinds of supportive things in a good community space for autistic adults. But this idea that we want all three of these major stakeholder groups in the same place at the same time, so that like from a professional's perspective, to me, the value would be, okay, you get to see autistic adults in a non-clinical space. What are their lives like in general? Who are they as people? So that you can have more context and more of an understanding of these kinds of things, because it seems like there's all kinds of stuff that the autism community, like adult autistic people, know about themselves that are still not widely known or recognized within mental health and other associated, autism support professions. And that seems to me completely avoidable. Like, there's no reason that information can't in some way be transmitted, but we just have to figure out how. But there's so much going on and so much lived experience within adult autistic people that why wouldn't we go directly to them for their understanding and their experiences? Why would we dance around or do this second or third hand when we could be asking them, hey, what do you think about supporting autistic people and what that might entail? So I'll leave it at that, but we hold those conferences every November. I think our website maybe needs an update right now. We're kind of gearing up to get our next one planned. But yeah, if you want to kind of mark your calendar for, it's going to be early November this year, whatever I think the first Sunday in November is, something around then. But I just want all of you to know that I really personally and professionally want all of you there, because all of you are relevant to this. We're going to be doing it virtually again this year, or at least with a hybrid component if we can pull that off. So it's going to be something that can be attended from all over the state, as we've also been doing the past several years ever since the pandemic started. I see it's 12 o'clock exactly, so I'm going to stop there, but I really hope to see many or most of you there. And any further questions about that, I'm always happy to field those as well. We'll put this in the chat. My Autism Society email is scott@autismsouthcentral.org.
Thank you, Scott.
Please feel free.
Thank you, and look forward to getting the details about Integral. We'll get that out to the community of practice because it's a vital conference in Wisconsin. Thank you for that. Thank you so much also for opening up a can of worms that we now have to figure out how to talk about those worms and talk to each other and see what we can do to make this world a little bit better for everyone. So I appreciate that conversation, and just so people understand, that's not going to happen overnight. But we need to start to gather together, convene, and start to talk about these things to make a difference. We're not going to be able to do it alone in our own little spaces.
We are all doing that in good faith. Yeah.
Yep, exactly. So I look forward to working with you on that, Scott. Thank you also to Tim and to Emily and to Megan and the speakers. Thank you to everybody who has been interacting in the chat. Amazing, possibly the most populated chat that I've ever seen in the history of chatting. Also, thank you so much for the site hosts of opening up your space and inviting people in. I love the fact that we can do this gathering in a number of different ways. Just to let you know, my time is brought on part of the LEND program at the University of Madison Weisman Center through the University Center for Excellence in Developmental Disabilities. We have a wonderful steering team of people from all sorts of parts of the community that join us, as well as leadership on that steering team, which we'll be sending out an email about. So if you registered and we have your email address, you will receive, when we have the recordings ready, you'll receive updates on the next community of practice, the questions and answers that we might be able to get from our presenters. We'll let you know where all that is going to house. Thank you all so much for joining us. Appreciate it. Have a fantastic rest of your day. On behalf of Katie, who is like, left or right hand. I don't even know which hand, but man, couldn't do it without the steering team and without the planning team. So thank you all so much for being here. Have a great rest of your day.